Welcome to our 5 on 5. We're pleased to welcome Brent Kell, the CEO of Value Immediate Care. Brent, good to see you again. How are you today?
Good to see you.
So tell us, and our viewers at home, in case they don't know, what exactly are you guys doing over there at Value Immediate Care?
Value Immediate Care provides a walk-in medical care for folks. They can walk in 7 days a week. Care for episodic illness and injury, things like sore throats and sprained ankles and cuts and bumps on the head and those sort of things.
Okay. And you guys have grown your business in a down economy. You guys are actually expanding. How have you guys been able to do that?
Well, I think it's a model that works. I think people need convenience for sure, and they expect convenience in all services now, and we've been able to provide that. I think in Southern Oregon specifically, access to healthcare is a huge issue. It's going to get worse with healthcare reform, and so having that doc or provider that you can step in on a Sunday afternoon or a Monday morning when it's convenient for you is definitely a positive business model, something that's worked. Yeah,
okay. And you mentioned healthcare reform. Certainly wanted to ask you about that, as we do anyone in that business these days. An interesting time. How have you guys been able to manage the changes in the healthcare system?
Changes are early on still. One thing's clear, there's going to be a lot more folks with insurance, and so a lot of folks are going to use that insurance. Since the 1st of January, I spend a day or two in the clinic usually, helping with patient care, and we're seeing a great increase of folks that have insurance, that have a laundry list of illnesses and injuries and things they've had for years. Sometimes even young folks that may had a knee injury back as far as high school, and then they hurt their elbow and they've had a sore neck and they've got a little spot on the back of their neck, and now that they have insurance, they're coming in and wanting all these things addressed. And so that's going to continue, I think.
Yeah. Now, is Value Immediate Care a primary care provider, or do you see people and refer them? How does that work?
We see, the short answer, we see them and refer them. An urgent care facility is really not set up to do primary care. And one of the big reasons is we don't have the surveillance piece. In primary care, you need to be managing people's health care, not their illness. You need to be checking to make sure they're giving their mammogram and they're having their prostate checked, making sure they're having a colonoscopy at age 50, and all these things that need to happen on a regular basis to keep people healthy. We manage more of the sick care and the episodic. For the generally healthy population, just has an episodic need for health care, we're fine. But patients that have chronic illnesses and diseases really should establish with primary care.
Okay, very good. We're going to take a quick break. Much more with Brent in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Brent Kell from Value Immediate Care, the CEO of Value Immediate Care. So, Brent, we're talking before about healthcare reform and all the changes to your industry. What about barriers to healthcare? Are we still seeing those?
We are. I think healthcare reform, both nationally and state-wide, has been focused basically on providing people healthcare insurance. That's been the big barrier, and I think in a lot of cases that's true. Southern Oregon, particularly, and even Oregon as a whole, we have other barriers, and that's access to healthcare providers. Southern Oregon could use more healthcare providers, particularly primary care providers, and so we're seeing that definitely. We're on the front lines of that, and people can't get in to see their primary care when they have insurance. Then they're seeing us. At least we're keeping those folks out of the emergency room and referring them on to a primary care provider.
Now, as a community as a whole, how do we go about perhaps changing that and bringing in more people, or how is that done?
The tough part is that Southern Oregon has an aging population. Obviously, it's a big retirement community. Virtually all those folks have Medicare insurance, and Oregon's one of the lowest Medicare reimbursement in the country. And so attracting young providers here that many times come out of school with big loans and young families wanting to purchase a house and set up life, and they can make over 2 times in other localities what they can here. It's sometimes a tough sell. Most of the providers that we attract here have some kind of family connection here, or they're born and raised here. But it's tough to attract outside providers. Even when I'm interviewing support staff, nursing staff, and things, the pay scale in this area is not what it is out of state.
Okay. All right. Now, on a different matter, you've been involved financially with YES, Youth Education Success. Yes. Tell us why you got involved with YES.
I believe that we shouldn't depend on schools only to educate and raise our children. And I think it's up to businesses to step up and provide funding, provide educational resources, mentoring programs. I really feel that's really important, and just depending on our school system to take care of raising our kids, I think is real short-sighted for us. And looking as a business down the road, getting kids interested in healthcare and wanting to go to school and become providers accomplishes the goals we just talked about, is bringing more providers and healthcare professionals into our business.
Well, very good. We certainly appreciate it. Brent, good to see you.
Thanks, Craig.
Thanks very much. Stay with us. We'll be right back.